Which hormone is primarily responsible for regulating blood glucose levels in the body? A. Insulin. B. Thyroxine. C. Testosterone. D. Progesterone. The correct answer is A. Insulin is a hormone produced by the pancreas. It helps regulate blood glucose levels by facilitating the uptake of glucose into cells. Which of the following is not a symptom commonly associated with hypothyroidism? A. Weight gain. B. Heat intolerance. C. Fatigue. D. Cold intolerance. The correct answer is B. Heat intolerance is not a common symptom of hypothyroidism. Instead, patients with hypothyroidism often experience cold intolerance. Which of the following hormones is responsible for the development of secondary sexual characteristics in males? A. Estrogen. B. Progesterone. C. Testosterone. D. Cortisol. The correct answer is C. Testosterone is the primary male sex hormone, responsible for the development of secondary sexual characteristics like facial hair, deep voice, and muscle mass. Which of the following medications is commonly used to treat epilepsy? A. Insulin. B. Levothyroxine. C. Valproic acid. D. Metformin. The correct answer is C. Valproic acid is a commonly prescribed medication for the treatment of epilepsy. It helps control seizures by stabilizing electrical activity in the brain. Which neurotransmitter is primarily affected in Parkinson's disease? A. Serotonin. B. Dopamine. C. Acetylcholine. D. Norepinephrine. The correct answer is B. Dopamine is the neurotransmitter primarily affected in Parkinson's disease. Decreased dopamine levels lead to the characteristic motor symptoms of the disease. What is the most common type of stroke? A. Ischemic stroke. B. Hemorrhagic stroke. C. Transient ischemic attack. D. Embolic stroke. The correct answer is A. Ischemic stroke is the most common type of stroke, accounting for about 87% of all stroke cases. It occurs when a blood clot blocks a blood vessel in the brain. Which of the following is a common symptom of depression? A. Mania. B. Hallucinations. C. Persistent sadness. D. Hyperactivity. The correct answer is C. Persistent sadness is a common symptom of depression. Other symptoms may include loss of interest in activities, changes in appetite or sleep patterns, and feelings of worthlessness. Which neurotransmitter is thought to play a role in the pathophysiology of schizophrenia? A. Dopamine. B. Serotonin. C. Acetylcholine. D. GABA. The correct answer is A. Dopamine is thought to play a significant role in the pathophysiology of schizophrenia. Antipsychotic medications work by blocking dopamine receptors in the brain. Which of the following medications is commonly used to treat symptoms of Alzheimer's disease? A. Risperidone. B. Donepezil. C. Lithium. D. Fluoxetine. The correct answer is B. Donepezil is a medication commonly used to treat Alzheimer's disease symptoms. It works by increasing acetylcholine levels in the brain, improving cognitive function. What is the primary hormone produced by the thyroid gland? A. Insulin. B. Thyroxine. C. Testosterone. D. Estrogen. The correct answer is B. Thyroxine is the primary hormone produced by the thyroid gland, and it plays a crucial role in regulating metabolism. Which sex hormone is primarily responsible for the development of female secondary sexual characteristics? A. Testosterone. B. Progesterone. C. Estrogen. D. Gonadotropin-releasing hormone. The correct answer is C. Estrogen is the sex hormone primarily responsible for the development of female secondary sexual characteristics. Which medication is commonly used to treat seizures in epilepsy? A. Lisinopril. B. Levothyroxine. C. Lamotrigine. D. Losartan. The correct answer is C. Lamotrigine is a common medication used to treat seizures in epilepsy by stabilizing electrical activity in the brain. Which of the following is a risk factor for Parkinson's disease? A. High blood pressure. B. Alcohol consumption. C. Family history. D. Sedentary lifestyle. The correct answer is C. A family history of Parkinson's disease is a significant risk factor for developing the condition. What type of stroke is caused by a clot blocking blood flow to the brain? A. Ischemic stroke. B. Hemorrhagic stroke. C. Transient ischemic attack. D. Embolic stroke. The correct answer is A. Ischemic stroke is caused by a clot blocking blood flow to the brain, leading to tissue damage and neurological symptoms. Which of the following symptoms is commonly associated with schizophrenia? A. Mood swings. B. Hallucinations. C. Memory loss. D. Muscle weakness. The correct answer is B. Hallucinations are a common symptom of schizophrenia. Their sensory perceptions not based in reality. What is the hallmark pathological feature of Alzheimer's disease in the brain? A. Amyloid plaques. B. Excess dopamine. C. Increased GABA levels. D. Hypertrophy of the hippocampus. The correct answer is A. Amyloid plaques are the hallmark pathological feature of Alzheimer's disease in the brain. They consist of abnormal protein clumps that disrupt neural function. Which medication is commonly used to treat symptoms of depression? A. Lorazepam. B. Levothyroxine. C. Lithium. D. Sertraline. The correct answer is D. Sertraline is a common medication used to treat symptoms of depression by increasing serotonin levels in the brain. Which of the following is a risk factor for developing type 2 diabetes? A. High fiber diet. B. Family history of diabetes. C. Regular exercise. D. Low body weight. The correct answer is B. Family history of diabetes is a significant risk factor for developing type 2 diabetes due to genetic predisposition. What is the primary hormone produced by the parathyroid glands to regulate calcium levels in the body? A. Insulin. B. Thyroid hormone. C. Calcitonin. D. Parathyroid hormone. The correct answer is D. Parathyroid hormone regulates calcium levels in the body. It increases calcium release from bones, absorption in the intestines, and reabsorption by the kidneys. Which of the following is a common symptom of Cushing's syndrome? A. Weight loss. B. Hypotension. C. Moon face. D. Hypothyroidism. The correct answer is C. Cushing's syndrome often presents with symptoms like weight gain, particularly in the face, what we call moon face, the upper back, and abdomen, due to excess cortisol production. Which of the following is a common symptom of bipolar disorder? A. Persistent sadness. B. Manic episodes. C. Lack of appetite. D. Excessive sleepiness. The correct answer is B. Bipolar disorder is characterized by alternating episodes of mania, with elevated mood and increased energy, and depression, with sadness and lack of energy. Manic episodes are a key feature. Which neurotransmitter is primarily affected in attention deficit hyperactivity disorder, or ADHD? A. Serotonin. B. Norepinephrine. C. Dopamine. D. Endorphins. The correct answer is C. ADHD is associated with imbalances in dopamine levels, leading to issues with attention, focus, and impulse control. What is the primary hormone produced by the pineal gland that regulates sleep-wake cycles? A. Melatonin. B. Cortisol. C. Thyroid hormone. D. Testosterone. The correct answer is A. Melatonin is the hormone produced by the pineal gland that regulates the circadian rhythm and sleep-wake cycles in the body. Which of the following is a common symptom of postpartum depression? A. Difficulty concentrating. B. Increased energy levels. C. Emotional numbness. D. Lack of appetite. The correct answer is A. Postpartum depression commonly presents with symptoms like persistent sadness, irritability, sleep issues, and difficulty concentrating, affecting the mother's ability to care for herself and her newborn. What is the primary neurotransmitter involved in the pathophysiology of anxiety disorders? A. Serotonin. B. Acetylcholine. C. Endorphins. D. GABA. The correct answer is D. Anxiety disorders are linked to imbalances in GABA, that's gamma-aminobutyric acid, the brain's primary inhibitory neurotransmitter. This imbalance leads to heightened anxiety and stress responses. Which of the following symptoms is commonly associated with Addison's disease? A. Weight gain. B. Hypertension. C. Hyperpigmentation. D. Insomnia. The correct answer is C. Addison's disease, characterized by adrenal insufficiency, often presents with symptoms like fatigue, weight loss, low blood pressure, and hyperpigmentation due to increased melanin production. Which of the following is a common symptom of epilepsy? A. Muscle weakness. B. Hallucinations. C. Memory loss. D. Depression. The correct answer is B. Hallucinations can be a symptom of epilepsy, especially during seizures. What is the primary hormone produced by the ovaries responsible for female secondary sexual characteristics? A. Estrogen. B. Testosterone. C. Progesterone. D. Melatonin. The correct answer is A. Estrogen is the primary hormone responsible for the development of female secondary sexual characteristics. Which of the following is a common symptom of Parkinson's disease? A. Memory loss. B. Tremors. C. Hallucinations. D. Mania. The correct answer is B. Tremors are a common symptom of Parkinson's disease, caused by the degeneration of dopamine-producing brain cells. In what type of stroke does a weakened blood vessel burst and bleed into the brain? A. Ischemic stroke. B. Hemorrhagic stroke. C. Embolic stroke. D. Transient ischemic attack. The correct answer is B. Hemorrhagic stroke occurs when a weakened blood vessel in the brain bursts and causes bleeding. Which of the following is a common symptom of Alzheimer's disease? A. Mood swings. B. Memory loss. C. Mania. D. Paranoia. The correct answer is B. Memory loss is a hallmark symptom of Alzheimer's disease, a form of dementia. Which neurotransmitter is primarily affected in schizophrenia? A. Serotonin. B. Dopamine. C. GABA. D. Glutamate. The correct answer is B. Dopamine dysregulation is associated with the positive symptoms of schizophrenia. Which medication is commonly used to treat stroke symptoms, dissolving blood clots and restoring blood flow? A. Warfarin. B. Thrombolytics. C. Levodopa. D. Haloperidol. The correct answer is B. Thrombolytics are used to dissolve blood clots in ischemic stroke and restore blood flow. Which of the following is a common symptom of bipolar disorder? A. Paranoia. B. Mania. C. Psychosis. D. Agoraphobia. The correct answer is B. Mania is a common symptom of bipolar disorder, characterized by elevated mood and energy levels. Which of the following is a common symptom of polycystic ovary syndrome, or PCOS? A. Irregular menstrual cycles. B. Excessive hair growth. C. Weight gain. D. All of the above. The correct answer is D. Polycystic ovary syndrome, or PCOS, commonly presents with irregular menstrual cycles, excessive hair growth, also known as hirsutism, and weight gain. What is the primary neurotransmitter involved in epilepsy's pathophysiology? A. Serotonin. B. Dopamine. C. Glutamate. D. GABA, or gamma-aminobutyric acid. The correct answer is C. Glutamate is the primary excitatory neurotransmitter involved in epilepsy, contributing to excessive neuronal activity and seizures. Which of the following is a common symptom of Wilson's disease? A. Kayser-Fleischer rings in the eyes. B. Memory loss. C. Muscle tremors. D. Hypothyroidism. The correct answer is A. Kayser-Fleischer rings, the accumulation of copper deposits in the eye's cornea, are a common symptom of Wilson's disease, a disorder of copper metabolism. Which medication is commonly used to treat symptoms of anxiety disorders? A. Sertraline. B. Levodopa. C. Lisinopril. D. Metformin. The correct answer is A. Sertraline, a selective serotonin reuptake inhibitor, or SSRI, is commonly used to treat anxiety. It works by increasing serotonin levels in the brain. What is the primary hormone produced by the pituitary gland that stimulates the thyroid gland to produce thyroid hormones? A. Cortisol. B. Insulin. C. Thyroid stimulating hormone, or TSH. D. Adrenaline. The correct answer is C. Thyroid stimulating hormone, or TSH, is produced by the pituitary gland. It stimulates the thyroid gland to produce thyroid hormones, regulating metabolism. What is the hallmark pathological feature of vascular dementia in the brain? A. Amyloid plaques. B. Neurofibrillary tangles. C. Infarcts or strokes. D. Lewy bodies. The correct answer is C. Infarcts, or strokes, are the hallmark pathological feature of vascular dementia in the brain. They're caused by impaired blood flow, leading to cognitive decline. Which medication is commonly used to treat schizophrenia symptoms by blocking dopamine receptors in the brain? A. Risperidone. B. Gabapentin. C. Aspirin. D. Lorazepam. The correct answer is A. Risperidone is an antipsychotic medication commonly used to treat symptoms of schizophrenia by blocking dopamine receptors, reducing psychotic symptoms. Which of the following is a common symptom of myasthenia gravis, an autoimmune neuromuscular disorder? A. Excessive weight loss. B. Double vision. C. Insomnia. D. High blood pressure. The correct answer is B. Double vision, also known as diplopia, is a common symptom of myasthenia gravis, characterized by muscle weakness and fatigue. What is the primary neurotransmitter involved in the pathophysiology of post-traumatic stress disorder, or PTSD? A. Norepinephrine. B. Acetylcholine. C. Endorphins. D. Histamine. The correct answer is A. Norepinephrine plays a significant role in the pathophysiology of post-traumatic stress disorder, or PTSD, contributing to hyperarousal and stress responses.